Hello, my name is Kelsey Tinker, and on this video presentation I'll be discussing cardiac tamponade syndrome, which is a syndrome that involves the excess fluid within the pericardial sac that surrounds the heart, and that excess fluid is just compressing on the heart, not allowing it to function correctly. And when the heart's not allowed to function correctly, it cannot get oxygenated blood to the body, which is where it's needed. Now, the manifestations of cardiac tamponade syndrome include having low blood pressure. If you have an increased heart rate, you can have bulging neck veins, restlessness, or something described as Beck's triad, which includes some of the manifestations I've already discussed, the low blood pressure and the bulging neck veins, but also someone will have muffled heart sounds. Now, within cardiac tamponade syndrome, there are some associated diseases such as hemopericardium, which is the sac is filled with fluid, but that fluid is blood. You can have acute pericarditis, which is the sudden inflammation of the lining around the heart, and it's painful. You can also have constrictive pericarditis, which is rare, and it's the long-term inflammation of the pericardium compared to, say, the acute pericarditis, which is sudden. Now, with cardiac tamponade syndrome, it is an emergency situation, whether that's from trauma or infection, and there can be a procedure done to relieve that pressure and that fluid called pericardiocentesis, and that relieves all of that pressure and that fluid. Now, there are 3 syndromes that are also included in the cardiovascular system, like cardiac tamponade syndrome, and that includes congestive heart failure, where the heart itself is just too weak or too stiff to pump blood effectively out of the heart. And that's similar to cardiac tamponade syndrome, but the heart is not able to function correctly in congestive heart failure because it's too weak, not because it's being encased in excess fluid. You can also have cardiogenic shock, where the heart pump can't pump oxygenated blood effectively, but this is due to a heart attack. It is similar to cardiac tamponade because it's an emergency, but it cannot pump due to a severe heart attack, not from excess fluid. And lastly, we have acute coronary syndrome, which that's an umbrella term where blood is suddenly blocked from the heart, say with a heart attack, not necessarily from there being constriction of the heart via fluid. Okay, that concludes my presentation on cardiac tamponade syndrome and some of the associated diseases and other syndromes of the cardiovascular system. Thank you.